Before I introduce the speakers to you, I will take some time to talk about Hep B United's mini grant program. Our mini grant program is one of our most sought after capacity building program. Next slide, please. Since 2014, Hep B United has distributed 85 awards, just under 750,000 to 20 states. We support local partners to improve capacity and increase screening, education, vaccination, and linkage to care. We distribute 6 to 8 awards every year, and the amount of the award ranges from $5,000 to $10,000. In recent years, we have opened the awardees to include PWID, African immigrants, and Asian American and Pacific Islander communities. Next slide, please. The focus of our mini grant program is to increase awareness, screening, prevention, and education to reduce hepatitis B related health disparities, which includes the implementation of the new universal adult hepatitis B vaccination recommendations, improving linkage to care and access to culturally and linguistically appropriate patient navigation services to prevent hepatitis B related liver disease and cancer, as well as strengthening surveillance or community level data collection to detect hepatitis B transmission and disease trends. Next slide, please. The process of applying to our mini grant program is very simple. We will release a forecast and an RFP a couple months before the application is live. Then we open our applications. The applications are pretty simple. In the last few years, we've worked really hard to make the application as simple as we can and make it as inclusive as we can. Once the application process wraps up, we run an internal and external review process. The internal review process includes Hep B United and Hepatitis B Foundation's staff. We look at the applications and see if it meets the RFP criterias. Then we and then we do an external review process. Our external reviewers are Hep B United partners, and they also help us look through the application and help us select awardees for that year. Once the process wraps up, we distribute our awards. Once we give our mini grant awards to our Hep B United partners, we do constantly check in with them to make sure their project is going well, and if there are any challenges that they've been facing, and if there's any way that we can support them. When we do open our mini grants program, you all will know we will make a lot of noise about it. We will we will promote it through our newsletters, through our social media, and if you are on Hep B United listserv, you'll get an email about it. So if you're not on Hep B United listserv, please let me know and I can add you to it. Moving on to our speakers now for today's session. We have Sonje Calamese, president of the Nigerian Diaspora Organization Americas. She has sent a pre-recorded presentation for us today, but I think she can make it to the Q&A session. Sonje is the youngest woman to serve as the president of the Nigerian Diaspora Organization Americas Ohio chapter. She is passionate about unity and cultural connection. She has led impactful initiatives.
My name is Sonje, and I'm the president of NIDOA, the Ohio chapter. I'm happy.
Sorry for that. She's passionate about unity and cultural connection. She has led impactful initiatives that bridge Nigerian Americans, African, and global communities. Next, we have Richard So, Executive Director of Hep B Free. Richard So is dedicated to eliminating hepatitis B and liver cancer with a vision of making the San Francisco Bay Area the first hepatitis B free region in the US and improving advocacy everywhere. He has over a decade of experience in healthcare, including 5 years as Executive Director of Hep B Free. His background spans healthcare consulting, Peace Corps service in rural Paraguay, and leadership across major coalitions like Hep B United, End the Epidemics, and California Hepatitis Alliance. Then we have Melissa Sullivan. She's a registered nurse and viral hepatitis coordinator for Drexel Hope. As a member of the Hope team, Melissa tests community members for hepatitis A, B, C, HIV, and other sexually transmitted infections. She enables our patients to get treated and cured of hepatitis C and empowers our patients to get empowers their patients to get vaccinated against infectious diseases like hepatitis A and B. Melissa is passionate about improving access to health education, treatment, and resources for underdeserved communities. Lastly, we have Afsana Monir, founder and executive director of Project New Yorker. Afsana is a Bangladeshi Muslim immigrant lawyer and the founder and executive director of Project NY. This is the first and only nonprofit learning center in New York City dedicated to serving Bangladeshi immigrants, especially women and youth. Combining her legal background with a deep commitment to social justice, Afsana takes a forward-thinking approach to community empowerment, integrating technology into outreach, education, and service delivery to bridge the digital divide and advance equitable access to health, learning, and civic participation. Without any further ado, now I'm going to ask Frank to play Sonje's pre-recorded presentation.
To share with you all my organization's experience providing hepatitis B education with the help of Hep B United's mini grant. Our organization decided that we would reach out in 3 different ways to provide hepatitis B education. The first way that we decided was going to be at a local festival. The festival was going to provide us with the opportunity to educate and provide testing to thousands of people over a 2-day period. Our organization has participated as a vendor at this festival over the last few years, so we were looking forward to connecting in a new way with the African community at this event by providing testing and education to people that attended. The Nigerian Picnic. This has been a summer event that Nigerians have expected to attend and have anticipated this event since the early 90s. Due to this event having longevity, advertising for it has been mostly through word of mouth and through the other organizations that help to host the event. We knew that this event would be a great event to provide education and testing due to the population that would attend. Digital media. Offering digital media was also a part of our plan to provide education, because what's education without having some form of digital media? So with this, we wanted to make sure that we had a digital media footprint that people could access education at any time that was convenient for them. We were very excited to be awarded this grant and work with Hep B United. However, the beginning of 2025 consisted of a changing political environment, and we quickly noticed that people were not attending large events or socializing in large crowds. Because the majority of our education and testing was based on large events, we had to make a change and quickly. Because offering hepatitis B education and testing was still our main priority, but we knew that we had to be creative with a new approach that was also meaningful and impactful to our audience. So, with us having to pivot, we decided that digital products would become our main focus. We created YouTube videos and we advertised digitally, allowing people to sign up for free testing. Our YouTube videos are in English, and we also created a Pidgin English version. Pidgin English is a slang that's used commonly in Nigeria. We provided our education to leaders in the Nigerian community to help us share and also bring awareness regarding hepatitis B. We also engaged in training sessions that allowed us to connect with other African communities to share and collaborate ideas. In October, we hosted our second annual Arts and Culture celebration, and this event focused on celebrating Nigerians in the diaspora, the arts and culture that Nigerians have contributed to the world. So we also used that event as a way to provide education and to direct people to our website and social media so that they could have access to the education that we created at any time that was convenient for them. These are some pictures and flyers from the events that we hosted. And I also wanted to include our arts and culture event that was in October. Now, even though this event did fall outside of our mini grant window, we still use this event as an additional way to provide hepatitis B education by promoting our digital products and also offer free testing to anyone that was interested. Thank you for your time, and I have included my email address if anyone wants to contact me, as well as our organization's website and to our YouTube channel if you're interested in looking.
Thanks to Sonje for sending us that pre-recorded presentation and giving us an insight to their mini grant program. Next, we have Richard So from Happy Free. Take it away, Richard.
All right, one sec. Let me pull up my slides here. Oh, it looks like I need to you have to allow me to share.
I just made you a co-host. There you go.
Okay, allow. Great. Okay. All right. Can folks see my slides?
Looking good.
All right. So thank you for the time. My name is Richard So, the Executive Director of Hep B Free. Our project, I think, is a little more, is a little different as we really try to tackle improving hepatitis B care across health systems. It was a tall order, and I'll go into some of the difficulties we had with such a tall order. The Hep B Foundation has been and Hep B United has been quite kind for us to do a lot of community education events. And so we said, how can we try to do something at the systemic level? Okay, so our goal was to make a systemic difference on hepatitis B care, primarily on this idea of we improve universal Hep B screening, as in try to implement it or some level of it, that hepatitis B care will improve across the board because systems will have to focus on that follow-up care, vaccination, and hopefully linkage to care. And so we had this idea to say we already have been established in the Bay Area, San Francisco Bay Area for a long time. So why don't we leverage those healthcare partnerships to identify the challenges and best practices in improving care, analyze the pathways of success for those systems that have done it, what made it work, what didn't, include a diverse set of healthcare institutions. We're talking major academic hospitals, private hospitals, community FQHC clinics, and public health departments. And then can we create some sort of document after talking to all these folks that makes it easier for health systems to not just say, yeah, we know we should be handling Hep B, but it's not a high priority, to say, okay, if it's not a high priority, what if we gave you the handbook to fix it? So on the right, you'll see this was kind of our pitch sheet to different systems saying like, hey, this is really worth it. And it was one of the first things we developed to kind of get in the door. So how we were going to do this, create the partnerships, create a survey, and an in-depth interview for each system. We worked hand in hand with leaders at Stanford University who they themselves in 2023-ish instituted universal Hep B screening. And what was really, really cool is they did it knowing that they wanted to write a paper about it. So they tracked everything about it, from like who they needed to talk to, how much it cost, who were the big stakeholders. And so they have a lot of details on that. And so when we talked about doing this, they said, hey, get us involved. We can add some like legitimacy and credibility. And when you reach out to other systems, you can say you're working directly with us. And so that's what we did. And so we connected with the DPHs, FQHCs, academic centers, and private systems that we had been speaking to. And we said, let's create a short survey and an in-depth interview to talk about all these things. And so that was like kind of our methodology game plan. And then we hit a bunch of delays. And I think this is something that came kind of, we do a lot of stuff in the community, and that sometimes takes a long time, but like a health fair is scheduled for a certain day. So you go there, you do the best you can. But for this, as we partnered with Stanford, they really wanted to make sure that the survey made sense for the target audience and discovering what that target audience was, as well as the uh, interview questions. And what we quickly learned is that this was critical. We could go through and quickly put together something, but if we go through all the effort of interviewing folks, are we asking the right questions? Is the right person answering the survey? Or simple things like, how long will the survey take? Initially, we said, this is important. We should make it like a 20-minute survey. And our lead at Stanford was like, absolutely not. Nobody will answer this. You'll send it out. People will say, this sounds nice. You got to make it under 10 minutes. And we're like, under 10 minutes? How could we learn enough? And so we really had to look at what we wanted to learn. Was it about just screening or also vaccination and linkage to care? Okay, if it's all three of those things, how do we make the questions make sense and be answerable? And then, are we asking your average primary care physician or just the change makers for these questions? And in our sense, if we ask the average doc, how many docs are in your system, and do you feel like this your doctors know about Hep B? They're going to be like, I don't know that stuff. And so we really had to think about all of that. So finalizing the survey and interview questions took a long time of back and forth with different stakeholders. And then finally, in navigating delays with busy academic institution folks was difficult. We had a hard time getting, we'd go back to the drawing board to fix something and want to check something within a week, and we'd be unable to connect in a meaningful way for maybe 2 or even 3 weeks. So things to consider. So with all that being said, we are still blazing forward on this project. It's definitely not on the expected timeline for the grants, but we're really, really appreciative that the Hep B United understands this and the scope of the project. So now we're finally getting to the interviews. In fact, I think we have one if they confirm on Friday, and that's really exciting. It's with a system that doesn't have universal Hep B screening now, which is really exciting because one of the big fears we had is that every system that was doing well would say, yeah, we'll talk to you and tell you how it is. And every system that didn't have as much investment or maybe have some issues that they don't want to tell folks might not be interested. And it looks like we'll have at least some that maybe it's with that collaboration with Stanford is paying off, or maybe that it seems more the relationship building is what's paying off. And so we're really excited. We plan to have 3 or 4 at least of the interviews of the about 10 that we're looking for done by the end of the year. And then by the end of the year, be able to do some of the analysis, look at what all the interviews came out with, and the surveys. And to be clear, the surveys are there so that there's some standardized form that can be compared versus the interviews, which are a little more qualitative and may a little be more nuanced. But the end result we want to make is create this document, what we're calling a blueprint, that uses these different answers to not only give best practices and challenges to look out for, but also case studies. So you can say, oh, Stanford did it a little bit like this, but UCSF did a little bit like this. I like part A from that. I want part B from this. And same thing if you're a Department of Public Health. Oh, San Mateo County has done it like this. Our system might be like that. And so let's look at what they have. We do intend to publish the results with Stanford. So we're hoping to do that in some sort of qualitative journal. And if you're really interested, we are still interested in taking partners on both the side that have succeeded at putting some things together to do universal or better screening, and those that are interested in more. Most of the systems that we're working with are in California, but we're also talking to RWJ Barnabas with Sue Wang in New Jersey. And so if this sounds something like you are really interested in and want to be part of it, please let me know. I wanted to be quick because I know we're running out of time. So any questions?
Thanks, Richard. I think we'll do question and answer once we're done with the presentation. And thank you so much. It's always so great to hear about the exceptional work you do at Happy Free. Moving on, we have Melissa Sullivan from Drexel Hope. Melissa.
I will share my screen. All right. Computer's just taking its time. Okay, can you see my slides or can you see my slides and my notes?
Just your slide?
Just your slides.
Beautiful. Okay. My name is Melissa Sullivan. I am a registered nurse and the viral hepatitis nurse coordinator or nurse eliminator at Drexel Hope. So today I'm going to talk with you about Drexel Hope and the strategies we use to increase Hep B screening, vaccination, prevention, and care. And just want to thank the Hep B United and Hep B Foundation for helping fund our efforts, and Shreya and Frank for all of the support in the last 2 years. So getting into Drexel Hope, we are based in Philadelphia, Pennsylvania, and we are a small but mighty team. And we have 2 main care settings. We're a mobile unit for our patients, and we also do community events for hepatitis and general infectious disease testing, education, and resources for harm reduction. So our primary goal is to be decreasing disparities and doing so by bringing treatment for opioid use disorder, other substance use disorder, HIV, and viral hepatitis directly to the zip codes that need it. So in Philadelphia, we're looking at areas where overdose rates are highest, where viral hepatitis rates and transmission is highest, and particularly focusing on marginalized communities like our Black and Brown Philadelphians. We provide low barrier healthcare at either low or no cost, and do so to really be able to draw in as many patients at high risk for hepatitis B as we can. So as far as our team, we have NPs, PAs, and an MD. So during our mobile unit days, we have a provider on the van. We have a program manager you can see here on the right. Me as the viral hepatitis nurse. We have social work involved and our peer recovery specialists who have lived experience with substance use. Our main services we provide are buprenorphine or Suboxone treatment and linkage to long-term care for people with substance use disorder, particularly for individuals injecting drugs or taking opioids. We provide treatment for stimulant use, alcohol, tobacco, and link people to treatment there. We also do Narcan training and distribution. My bread and butter being viral hepatitis, HIV, and STI testing through phlebotomy, which is where we test for Hep B, and through rapid testing for Hep C and HIV. General infectious disease education, a lot of Hep B and Hep C education there. And then we offer PrEP and post-exposure prophylaxis for HIV, wound care, gender-affirming care, contraception, and any other harm reduction that our patients need. So getting into the hepatitis B services we provide and how we integrate them into our model. Like I said, one setting in our clinic model is having a mobile van that goes out into our community. And so once a week, right now it's every Tuesday, we go out to neighborhoods that need us. We are positioned on the side of the road and just see people as they come up to us for services. So the first way we do this is having a viral hepatitis nurse navigator. So as a nurse navigator, I'm working with patients for education, for their testing for Hep B, helping them link to vaccines and to treatment if needed, and really following up closely on serostatus for individuals and tracking any of their vaccine needs. Our whole staff is trained really well in a general infectious disease education model primarily for people who inject drugs or have high-risk sexual behaviors. So they can, anytime someone comes up to the van, whether they're talking to a student or a peer, we are all well and able to give that education for them. On our van, we offer phlebotomy, so we can test for Hep A, Hep B, and Hep C. And that is primarily done at our mobile unit currently. We also do the full care cascade for Hep C treatment. So for individuals who test positive for viremic Hep C, we can initiate and help them get fully treated for hepatitis C. And that requires hepatitis C testing and vaccination as well. So the main success we've had is with Hep A and Hep B vaccination results and helping patients link to care for vaccination. So getting into our patient flow and how we really integrate this in our setting is it starts with outreach. So our peers and as our nurse and our program manager are doing outreach constantly to see what organizations in our community are looking for Hep B services, who's looking for services for people who are injecting drugs or for individuals with high-risk sexual behaviors. And then whether it's through referral, it's through people that we outreach to, a patient comes to our mobile unit, or they may just walk up on the street. And the first thing we're doing is talking with them about risk factors and doing that general education, doing a risk assessment for our patients. Next up, they'll get connected to me as the RN on the mobile unit, and we'll do a visit talking through what they're interested in as far as testing and doing this opt-out lab model. So kind of like Richard was saying, doing this universal screening unless people specifically ask not to have Hep B testing done. So we'll test them for Hep A, Hep B, Hep C, HIV, and then we'll do STIs as well, like chlamydia and gonorrhea, if they're interested, and figure out what they need based on that. So once we have someone come back negative for immunity against Hep B, assuming they don't have an active Hep B infection, our next thing we jump onto is linking them to vaccines. So we've had really great success with vaccine linkage. And the way we do it, like I said, is we test someone, next week they come back, and we talk to them about the need for vaccination. And we've partnered really closely with partner pharmacies in the area. So in the neighborhood, we ideally try to find a walkable pharmacy where we can same day walk them in and get a Hep B vaccine in their arm and take out any of the barriers to it for them. So we're calling ahead to be sure, do you have the Endrix or the Heplisab vaccine, whatever it might be. We are then walking a staff member, whether it's me or a student or a peer, will walk them directly to the pharmacy, provide their insurance information, and help them guide through many of the barriers that will often come up when someone's trying to get a vaccine, whether the pharmacy can't find their insurance, they're not sure exactly what vaccine they need. And then we ideally just sit with them, help continue to provide that counseling for the benefit of vaccination. We have also seen our new location in North Philadelphia is what we call a vaccine desert. So there aren't any vaccines walkable in our area. And so we've also started providing, having the option, thanks to the Hep B United grant, to provide transportation if needed and through other funding sources to help patients get to their vaccine appointments. And then we also do a lot of linkage to care in whatever way that means. Thankfully, we haven't had anyone come up positive for an acute or chronic Hep B infection currently, but we would link them either internally to our parent clinic at Drexel University if they had HIV and Hep B co-occurring, or we would link them to partner sites in the city. We can also link them to social resources and other types of harm reduction sources. And then our peers do a great job of just keeping up, following up with patients to see how they need more support. The next wing and the next setting we do is community events. We have had really great luck with rapid testing, education, and resource provisions at various places around the city. So we start and have started in the last year with a lot of shelters in our area. So going in, and at this point, we've been able to do rapid testing for Hep C and HIV, but we'll do a lot of education and provide pamphlets and resources. As you can see here, this is our whole layout and resources we always provide to our patients to talk through Hep B risk, talk through needs for getting treated, tested, vaccinated. And ultimately, our goal is to have phlebotomy testing events available as well, and I'll get into that in a little bit. But it's been really great to be able to partner with community members here. Okay, so as far as the numbers go, Hep A, we have tested 72 people in the last year or two. We have had approximately 24% of our patients who either have never been infected or have never been vaccinated against Hep A. And so we've seen 53% of our patients get at least one dose of vaccine. 65 people have been tested for hepatitis B. We've seen no one with acute or chronic cases, some potential distant exposures or distant cases. And then 32% of our patients were Hep C surface antibody negative and eligible for vaccination. So with our vaccine strategy that we've done, we have gotten 65% of our patients to receive at least 1 dose of the vaccine. And then hepatitis C, because of the rapid test, we're able to test a lot more people. So 250 people tested, 7.6% of those were viremic Hep C cases needing treatment. And we've had 84% of those patients start treatment with different rates of success around completion of treatment for cure for Hep C, or just not staying remained in or engaged in care to get that 12-week check-in to confirm cure. So some of our main successes, number one is just viral hepatitis screening for all of our patients. Any community member in Philadelphia, regardless of drug use or drug of choice, is someone we want to test for Hep B. We have seen that integrating substance use care with hepatitis and infectious disease care in general means that high-risk populations are tested, they know their results, and encouraging that follow-up so they can stay engaged. Next up is navigating the transitions of care. Having a nurse and having peers involved in navigation has really been essential in helping people get all the way from testing all the way through vaccination, determining if they want to be on PrEP, and just finishing out that full cascade of care. That also includes, I might be looking at, okay, Medicare doesn't authorize Hep B vaccination. So we're working on doing and helping people get it by doing authorizations for that. We also, something we can share if people are interested, have created a vaccine demographics and dose sheet. So if someone can't get the vaccine with us today, but they do want to get it, we can help provide their insurance, the doses that they need, what they're looking for, where they're going, so people can just really have all the information they need when they go to the clinics. We've also, a new perk is we've had contingency management, so gift card incentives possible for people getting vaccines. That's new in the last couple months, and we've seen people really eager to get vaccinated and get a gift card incentive with that. And then also offering PrEP as Hep B prevention. Last up, some of our barriers. Readiness for testing and vaccination is always a big one. That might be fear of needles, lack of trust, not feeling like it's a high-risk need for them. We have some people who inject drugs who just have really hard venous access, so it's tricky to get their blood. Some of our patients have unstable housing or poor phone access, and so we can't always reach them about their vaccine needs. Stigma, because we're an opioid use clinic, and so people may not want to engage with us. We've also really wanted to be able to do phlebotomy events, but the insurance component is really difficult since it requires insurance coverage for people to get Hep B testing done with phlebotomy. And so we're hopeful. We've heard some things from Hep B United that there's a lot of work being done on developing rapid testing for hepatitis B. And then finally, just access to vaccination is really huge for our patients, and being sure that they can get to a pharmacy, they can get the dose that they need, they can get it in their arm. And that is all I have. We've found that having support people to help patients navigate the system, whether that's a case manager, whether that's a nurse, whether that's a peer, has been really essential for helping people get all the way through to the care that they need for Hep B, and allows us to educate, test, vaccinate, and link our patients to care for hepatitis B and health in general. So thank you, Hep B United, and thanks everyone for listening.